Hi everyone, welcome to Sandy K Nutrition, Health and Lifestyle Queen, and I am live here at the Miami Biohacking Congress, where there are over 30 exhibitors and speakers and so many like-minded individuals. But today I am interviewing Dr. Alan Bauman, and I'm just so impressed because you're one of the top 20 hair restoration physicians in the world.
Yes, that's right. Well, thank you for having me, Sandy.
It's great
to be here
yes.
at Biohacking Congress, Miami. But yeah, so we've been blessed with that ranking for a number of years now. We're ranked as one of the top surgeons in the world. It's been pretty exciting because we do have patients from all over the world that come to us and want to keep the hair that they have and restore the hair that they've lost, and that's just such a life-changing thing. So
yeah, and there's so many options, right? So we're going to talk about that today, but first you have to tell me a little bit about yourself. How did you get here?
Yeah, so my journey started back when I was a teenager. Well, if you ask my grandmother, when did Alan decide he wanted to go to medical school, she probably would have said the day he was born.
Yeah.
So it was kind of preordained, but I was good enough in math and science that made sense, at least. I was mentored at an early age when I was a teenager by a very prominent and excellent, talented plastic surgeon in Manhattan. And he kind of set me on the path of let's just say the cosmetic aspects of health and wellness, right? Making people look good and feel good about themselves. And I always thought that that's what I was going to do, plastic surgery, cosmetic surgery. And so college and medical school and internship and residency, I didn't know anything about hair or hair transplantation at that time.
Right.
And I was introduced to a patient who had had a hair transplant. And of course, like everybody else, probably even today sometimes, people think it's going to be pluggy or nasty looking or weird. I looked at this guy and I was like, wow, where did you get your hair transplanted? It looks amazing. And so he told me a little bit about his experience with single follicle implantation. And so that was a little unusual.
Okay.
Because at the time in the 1990s, there was a lot of scar tissue and a lot of plugginess going on and things like that. And his results looked amazing.
Okay.
And so I thought, wow, this might be an interesting technique or procedure to be able to offer to my patients in the future. So I started to look into it little by little by little. But one of the things that I remember most about that pretty short conversation with that patient is how the hair changed his life. So it was transformational. He spent time telling me about his job opportunities and how it changed him professionally. He told me about how it changed him socially, how he really came out of his shell. And so I remember that transformative description that he was telling me, and I was like, wow, I really got to look into this. And so that's how I got started on the path. And that was almost 30 years ago.
Okay, so you've been doing this for a long time.
Yes, so I'm a full-time board-certified hair restoration physician.
Yeah.
I've been in practice over 25 years in Boca Raton, Florida. I've treated over 30,000 patients, performed over 12,000 hair transplant surgeries, and over 10,000 regenerative treatments like PRP and similar types of therapy.
Okay, so that's unbelievable. Like, your credentials are incredible, and you've done so much. So, educate all of the listeners on, there's different types of hair loss, isn't there?
Yeah, absolutely.
Yeah.
So that's one of the first things that I think, if you're struggling with your hair, whether it just doesn't look right anymore, or your ponytail is shrinking, or you're seeing more scalp shining through, or if you're a man and your hairline is receding, if you've got patchy hair loss or breakage or shedding, there's so many different symptoms that could occur. We've got to figure out your diagnosis. Right. So that's the first thing. You can't just run and jump and go get a vitamin, if you don't know what you're treating. That's not the right way to do things. And you're going to waste a lot of time and effort and energy. And unfortunately, maybe not get great results and get very disappointed along the way.
Yeah.
So I always suggest to patients, first, as soon as possible, connect with a board-certified hair restoration physician. And even if it's virtual, patients contact me from around the world. We can talk over Zoom. They don't even have to be in the office to initiate treatment. Okay. There's a lot we can do to get to the bottom of the situation.
Okay, that's great.
Yeah. And so, here at Biohacking, we're not just talking about hair loss diseases, but we take a more holistic approach in the practice. And I've really translated that down into my practice. And what we've learned to do is look at the look at the patients in a more holistic approach. So what's their lifestyle? What is their sleep-wake cycles? What are they eating? What is their nutritional status? What's their inflammatory status? What are the other issues that are really impacting their overall health and wellness? Because hair is such an important sign. It's a barometer, if you will, of your inner health.
I couldn't agree with you more than that, because coming from somebody who had thyroid disease, I know that could be one of the causative factors of hair loss, right? So finding out the why is really important. Now, I mean, obviously the most common thing is male pattern baldness. Like, is there different, but there's different types of that, right?
Right, so one of the most common things that we see in the practice, men and women, is a genetic tendency towards hair loss.
Okay.
So the androgenetic alopecia is the most common diagnosis, if you will. And that in men looks different than women, right? We say a receding hairline in men, thinning in the crown, you could result in total baldness, but it spares the hair around the sides and the back.
Right.
In women, it looks a little bit different. They can lose their density diffusely in the front. Sometimes it recedes a little bit. Maybe you feel a difference in the thickness or the volume of your hair.
Yeah.
Maybe you're seeing more scalp shining through. But both of those can be genetic and actually driven by androgens, which are the male hormones that both men and women have.
Okay, when you say androgens, so just to clarify, because let's say you're a 28-year-old man and you're starting to have a receding hairline.
Mm-hmm.
Does this mean you have too much testosterone, or like you're saying the androgen hormones, right?
Right, so it's not necessarily the amount of androgens that are triggering the hair loss, but your sensitivity to it. So that's what you inherit, androgen sensitivity.
Okay.
So for someone who's not very androgen sensitive, they could, have a high level of testosterone, they could be an athlete and work out and all of this business, and their hairline stays pretty much the same, maybe for decades and decades until much later on in life.
Okay.
But you could have someone who just has a low or moderate level of testosterone as their normal level, and they are very super sensitive to the androgens, and they're seeing more hair loss occur. Now, but let's be specific. When I say androgens, I'm not saying exactly testosterone, although that is the master androgen.
Yeah.
I mean DHT, dihydrotestosterone,
Okay.
which is a metabolite of testosterone.
Yeah.
So testosterone gets converted into DHT. DHT is the trigger for male pattern baldness.
Ah, okay. That's very interesting, but women can have that side of it as well?
Yes, so we know specifically in men that's the primary driver, the
Okay.
DHT. And so that leads us to some therapies to try to reduce the effects of the androgens. In women, it can sometimes be a driver of the condition. So, and especially sometimes when women get into menopause and they go on hormone optimization therapy,
Yes.
and that might include testosterone
Yep.
for all the great benefits that we talk about here at biohacking and other
Yes.
places.
Yeah.
Sometimes if you're androgen sensitive, that can trigger some hair loss. And especially if you're overdoing it. So your doctor may not realize he's overdoing it for you, but sometimes pellets, injections, and things like that, they tend to stack up, and you can get a receding hairline from that. I've treated many women, postmenopausal women, who have hormone replacement triggered androgenetic alopecia or female hair loss.
Yes, because you do see that quite often with midlife women, and I don't know whether they're on hormones or not, but you see that real thinning, patchiness. But there could be other underlying causes too.
Absolutely. So that's why we take that holistic approach.
Yeah.
So not just the lifestyle factors, but is there hormone dysregulation? What's going on with their thyroid? Is there inflammation?
Yeah.
What's their sleep-wake cycle situation? Are they stressed? Are they having perceived stress? Did they go through a physiologic stress? They get a hip replacement or breast augmentation? Did they have some kind of surgery? Facial plastic surgery in particular can trigger a lot of hair loss.
Really? I've never heard that.
Yeah, well, your plastic surgeon's not going to tell you that. We're not going to warn
I've never
you
had
usually.
plastic surgery either yet, so.
Well, that's good. You don't need it. You look beautiful. But a brow lift or a facelift procedure can sometimes be a trigger for hair loss. And of course, you can be left with a scar that doesn't grow hair.
Okay, so somebody would come to your facility.
Mm-hmm.
You would probably have a consult with them, and then at that point, it's about figuring out which route to take. Because then you can have
Right.
many routes.
Right. So let's talk a little bit about the evaluation process.
Yeah.
When someone comes into the office, we're going to do a detailed hair measurement. So we have a couple of different ways to execute that. We have an AI-powered microscope that uses artificial intelligence to count non-trimmed hairs. So that actually quantifies all the hairs in a given zone. So we can take a picture of several different zones. The images go up to the cloud, they come back down in about a minute, and all the hairs are counted and sorted. So it'll tell you how thick each hair is in that zone. So it gives a graphical representation of what's going on. In areas that are more permanent, you're going to see a lot of density and better quality hair. In areas where, let's say, a hairline is receding, you're going to see thinner, weaker, wispier hairs, or depleted density, which is not so good. So we're going to sort through all of that. There's some other measurements that we could do as well. We also can do genetic testing to see what kind of therapies you're most likely to respond to.
That's beautiful.
So a lot of folks will, let's say, grab the easiest treatment, which is, maybe a bottle of Rogaine at the supermarket.
Yep.
But what we know today is that a lot of folks cannot convert minoxidil, the stuff that comes out of the bottle, into the active metabolite minoxidil sulfate. There's an enzyme pathway there, and now we know through genetic testing the reason why a lot of patients don't get great responses from minoxidil. So people say, oh, it didn't work. Well, now we know why.
Yeah.
And so if that's the case, we don't have to wait for a year to figure out, oh, it didn't work, or maybe not as well as we wanted it to. We can do the genetic test and we'll know right away a shortcut to the compounded pharmaceutical interventions, so we're saving time and money and follicles all at the same time.
Right, because the fact is that when somebody's having hair loss, you don't want to be wasting a year of trying something that's not going to work anyway.
Sandy, what we say in the world of hair loss is that time is follicles.
I like
Okay,
it.
so time is follicles. Why? Because every moment that you're going through life, a week, a month, a year, without adequate diagnosis or treatment, you're losing hair.
Yeah.
And it can happen just with age, it can happen due to the hereditary process, it can happen due to nutrition and the other lifestyle factors that we talked about.
Okay, I have to ask you this one question before we continue.
Yeah.
Is it true that a son follows the maternal grandfather?
Yeah, so
or is that not true?
Well, this is great. I love myth busting. So the mother's father traditionally has always been said, oh, you're going to be able to tell your follicular fate from looking at your mother's father. It's sometimes true, but not always. So we know now that there are 200 different, let's call them genes, right, that regulate hair color, quality, texture, your sensitivity to androgens and other factors too in terms of hair cycling or other factors that can influence hair loss over time. So it's not so simple like, oh, my granddad is okay, so I'm going to be safe. No.
Oh, okay.
Yeah.
That's good to know.
My dad had extensive hair loss. My dad's dad, my grandfather on that side, never met the guy with hair. My mom's dad had a big bald spot. So, I've been toying with this problem for a long time. It can come from both sides of the family.
Okay. This is good to know. Very good to know.
Yeah. So just because your, mom's dad looks okay, that doesn't mean you're safe. There still could be a lot of reasons why you're losing your hair.
My dad's 85. And so, and he's still got a full head of hair. Mm-hmm. And so my son's like, I'll be fine.
Yeah.
And so maybe he will be, right?
Well, he might be, and that's okay.
Yeah.
But look, there's 80 million Americans out there with hair loss, right? That's a lot of folks, and hair loss is chronic and progressive. It gets worse with time, and you can lose 50% of your hair without it being noticeable to the naked eye in a particular zone.
Oh, I believe that, for sure.
So that works against you in the early stages, right? Because you think you're looking fine and good, oh, I've got coverage and so forth, but really you're losing density every year. But it also works to our advantage with hair transplants, because when we put hair back, we're not putting back every single hair that you lost, since you were a teenager. We're putting back enough for coverage. And thankfully that's a fraction of what you originally had.
Okay, so let's get into that, because I know we've covered off that there could be many different causative factors to hair loss. So what are the options? What can people do?
Right, so options range from simple things like making sure your scalp health is on point, right? So there's no inflammation, itching, and so forth. And I have an entire...
Can I ask you, does shampoo matter?
Yes, it does. I'm going to tell you why. Okay.
Yeah.
First of all, there's no miracle shampoo hair growth, okay?
Okay.
But here's why shampoo and scalp hygiene matters. I have an entire department called the trichology department. So the trichology lab at Bauman Medical is called Salon B. And what we do is we make sure the scalp health is on point. And why is that important? If you have inflammation of the scalp, itchy, flaky, dryness, redness, irritation, that's a sign of inflammation. And inflammation can absolutely trigger hair loss and make the hair quality worse.
Okay.
So we have to get the soil healthy before
Oh.
we plant a seed, okay?
I like the way that's put, yeah.
Right. So that's something we would do. So yes, so using the right types of shampoos, right, for your scalp pH level, moisture level, sebum level, whatever that might be, in your hair styling regimen, and then using it the right frequency.
Oh, what is that?
Well, that's variable. That's why you need this evaluation. Because
Interesting.
everyone's different. Now, most people go through trial and error, like, oh, I'm getting buildup. That means I'm not doing enough frequency, right?
Yeah, because you know,
Or I'm doing it too often and my hair's getting frizzy and dry.
it's interesting because you do hear a lot of things, and I've heard of this new place that's opened up that they analyze your scalp and they say that you should be washing your hair every day, but then you hear other people who say that you shouldn't be washing your hair every day.
Right.
So it gets
Let's
confusing.
talk about that. So,
Yeah.
I mean, obviously, you know, you're not going to treat the skin of your face the same when you're 10 years old, 20 years old, or 50 years old, or 80 years old, right? You're going
Right.
to treat your skin completely differently during those phases of
Yes.
life. Well, your scalp also, it can change over time. So there's no one rule. Some people have oily skin, some people have oily scalp, some people have dry scalp and dry skin. Sometimes there's a combination,
Yeah.
right? Sometimes you could be dry and oily, dehydrated and oily. And sometimes you could be not oily enough, and overhydrated. There's a lot of different variables. So scalp health is critical. It's
Okay.
not so simple. It's not, and you're better off like spinning around with a blindfold in the supermarket aisle sometimes, and picking a shampoo that way, rather than trying
Yeah,
to
I
listen to
know.
all these blogs and readers and things like that.
Right. So what do
you
you do? How do you know what shampoo? Like, because there's some shampoos that are specifically geared to men's scalp health and follicle health, so that you don't block the follicles.
Right. So let's just talk about let's just make it simple.
Okay.
Shampoo is a detergent.
Yeah.
I mean, bottom line, it's a soap, it's a detergent. The idea of shampoo is to clean whatever you're trying to wash, whether
Yes.
it's your scalp, your hair, if you have dirt, debris, skin cells, sebum from oily scalp, hair product, you want to get that out of there. So that's what shampoo does.
Yes.
So, but you want good ingredients in the shampoo. You don't want excessive chemicals that are harmful to the scalp, right? You want as natural as possible. But everything is a chemical, so sometimes chemicals you think that are natural can actually be harmful. You have to figure this out. Then what does the conditioner do? Conditioner imparts the moisture back to the hair fiber.
Right.
Because you've done the detergent, the shampooing. Now the scalp and the hair is completely dried of all that sebum, which was Mother Nature's moisturizer. You've got to condition the hair to put that back and
Yes.
to protect the hair, especially if you're going to style. So if you're going to style with heat or chemicals or whatnot, you definitely want to protect the hair fiber. So at the basic level, shampoo and conditioner is required. Now, what ones and how what frequency, that's what we figure out in the trichology zone.
Okay.
Yeah. And then, so once the scalp health is on point, we can talk a little bit about nutrition. So are you protein deficient? Are you iron deficient? Are you anemic? Because if that's what that's going to be an uphill battle. We can stimulate the scalp all you want. But if you're on some vegan diet or whatever that has no protein, forget about it. You're not going to grow hair. Hair is protein. It's keratin. I mean, that's why people go through shedding and when they go through fasting phases sometimes.
Yeah. That makes so much sense because we need those amino acids.
Correct.
Absolutely.
So hair follicles are highly metabolic, right? Rapidly dividing, which is one of the reasons why, God forbid, if you needed cancer treatment, it knocks out what? It knocks out your bone marrow, it knocks out your GI tract, it knocks out your hair. Well, those are the three most highly metabolic cell populations in your body. They're most highly replicating. Hopefully it's knocking out the cancer too, right?
Yeah.
But so the point is that we want to nutritionally benefit the hair at the same time. Make sure you're not deficient. So we have nutritional supplementations that are building blocks like vitamins and biotin and protein supplementation. And we have other things like probiotics to enhance the absorption of that and keep the inflammation down. And we have specialty supplements that are geared specific to things like if you're stressed out, we need ashwagandha. Let's put that.
I love ashwagandha.
Yeah.
Yes.
So there's other things too, but we have stem cell support nutraceuticals. Under the Bauman brand, we have the Wellness System for Hair, and we call that the Nutri-Team.
I love
So they're all
that.
different players in that team. But so those are the basics. And then we move on to what are non-chemical therapies. And I was asked in a panel, your panel,
Yeah.
today, what my favorite hair biohack is. And of course, I'm geared towards first do no harm. So red light therapy is a non-chemical, non-invasive, side effect-free way to enhance hair growth. And so, as you know, as I mentioned moments ago, low-level laser or photobiomodulation on the scalp, I think, is everyone's primary biohack. That should be the first thing they're doing, because they can never ever get hurt with that.
And you can't go wrong with it.
Correct.
Right? Like, but it's still not the same as, like, I have a giant Juve panel. It's not the same as having something specific for the scalp, is it?
It's not the same. Juve is LEDs. A laser cap, like the turbo laser cap, is all laser light.
And plus
So
it's
it's
directed.
different.
It's
Correct.
directed on the scalp versus a panel that you're looking at.
Correct. So we have a specific wavelength. We have the focus beams, which pass directly through and between the existing hair fibers,
Yeah.
to get right directly to the scalp. The device is specifically for scalp treatment. The Turbo has over 300 diodes. It covers 25% more area than any other device on the market, and it has the shortest treatment time, 5 minutes, lifetime warranty. And for most people, it's going to be their least costly hair regrowth treatment ever.
And-
Period. End of story.
And will that
Over
help
time.
anyone?
Well,
Like,
as long as you have hair. Okay, so that's the caveat,
Yes, we
right? We
talked
talked
about
about that.
that.
So if the hair follicle's dead and gone, we're going to need something more invasive than
Yeah.
laser light with the turbo laser cap, or regenerative treatments like PRP or the new TED. You're going to need to do something more aggressive than that.
what's PRP? I know what it is, but tell everybody, because it's kind of cool, isn't
Yeah.
it?
So PRP is a regenerative treatment. It's cell therapy. It's the workhorse of regenerative medicine. We've done over 12,000 platelet-rich plasma treatments. So that's what PRP stands for. We utilize a blood sample, and we harvest the platelets and concentrate them, and then re-inject them into the scalp in a painless way. And the purpose of that is to get the growth factors, which are very, very powerful for tissue regeneration, repair, and hair growth, get them out of the platelets and into the skin. So we basically are harvesting those platelets, getting them back into the skin, reactivating those platelets so that they release their growth factors.
Beautiful.
Yeah, and so what does that do? In less than, let's say, less than an hour in the office under local anesthetic with no recovery or downtime, you get a boost of hair growth with that treatment that's going to last 10 to 14 months.
Okay, so interesting. I had PRP done, but for different reasons. I had a chronic Achilles tendonitis that wouldn't heal. And I haven't had a problem, and it's been 5 years.
Did it work? Okay, great.
It worked.
Right.
It took 6 months, though. It took 6 months before it started to really kick in.
Yeah. So that's not
So-
uncommon when you're trying to heal a tendon or a joint. You get the
Okay.
treatment, the healing takes place, you've turned the clock back, you've knocked out the inflammation, and you're good.
Yeah.
But remember that hair loss is chronic and progressive. So
Okay.
you need to keep your foot on the gas pedal. You have to keep pushing. So PRP will give you a boost of hair growth. It's going to last for a period of time, and then at some point, it's going to start to diminish the effect. So you have to boost it again at that.
What about layering treatments? Like,
Oh my gosh.
what about PRP with the laser and
Yeah.
right?
So the presentation I gave here at Biohacking, of course, stacks treatments, and I
Yeah.
showed amazing results using a combination of therapies. So you have, I think the examples that I showed were basically 60 to 80-year-old women who, quote unquote, maybe mahjong together, maybe, but these women started with topical medications, prescriptions, as well as laser light therapy and a little nutritional modification, and had dramatically changed heads of hair, like dramatic.
That's amazing.
Yeah, so of course, stacking treatments that are non-redundant, right? So that are synergistic, PRP and laser, right? Those are great non-chemical therapies, no chemicals whatsoever.
Yeah.
You can do that immediately. And just remember, if you're looking for PRP, not all PRP is created equally. If your PRP provider is filling up little test tubes with a gel separator, that's no bueno, as we say in South Florida. That's not the right way to do PRP for the scalp. That might work for
Okay.
healing, it might work for
Okay.
skin, but that's not going to be good for scalp. You need to use a dual spin, high density platelet count process, and that's something that we've developed over more than a decade and a half.
Wow.
Yeah, so it's a powerful treatment.
So stacking is really important.
Correct.
You can actually see a patient and just stop with the genetic testing and let's do some nutraceuticals and you'll be on your way, or you can continue and keep going. And then, I guess, what is it called? FUE?
Right. So
That's like the the gold
Right,
standard.
the big kahuna, right,
Right.
is transplantation. If the
Yeah.
follicle's dead and gone, we're going to need to transplant. But even before we get to that point, obviously, first do no harm. We're going to do non-chemical therapies first, and then track your progress, make sure that things are going along in the right way. But if you have a deficit, a depletion of density, whether it's a balding spot in the crown for a male, or if you have overplucked your eyebrows, or if you've had a plastic surgery procedure that's left you with a scar and need to fill that in, or you have depleted density that's severe in the front or the hairline, you're going to need a transplant to fix that. And that's what Dave Asprey did. So he's a very public patient of mine. He came in, he wanted a lower hairline, and he wanted to fill in the bald spot in his crown.
Yeah.
And so what did we do? We executed a 2-day FUE procedure, follicular unit extraction. It's all microsurgery, no scalpel, no stitches, no linear scar left behind. And we take those follicles out from the back of the scalp, implant them artistically into the new hairline with the correct angle, orientation, and position. Recreate the swirl on the crown, so there's a lot of angle changes there.
Very cool.
All of that requires a team of people, about 20 man-hours per day, 2 days back to back. And normally, for an average human, about 10 days of recovery in terms of cosmetic.
Okay.
But if you're Dave Asprey and you're superhuman, you can cut that in half.
Right.
So
we know this.
He healed in 5 days. Yeah, he was completely healed in 5 days, and he grew, instead of at 4 months, he was growing at like 6 weeks.
Now, does it leave the scars in the back? The little dots?
So years ago, people used to do plug harvesting. So that was a 4-millimeter punch, which is about the size of a pencil eraser. And
That's
so when
big.
you take out a plug, that would leave a big scar that was visible to the naked eye if you shimmed your hair. So that's not so good. In between that was the linear harvest, where that's what I was trained in 25 years ago, to take a strip and sew it together to get the follicles. That leaves you with a long scar. So that's old school. Today, minimally invasive procedures leave no linear scar, but yes, they are permanently taking out the hairs.
Right.
So if you shave your head, down to a buzz cut, right, down to a 0, what you see back there is a 5 o'clock shadow, just like what you would see after letting your beard grow, let's say, for a day or 2, right? But if you took out some of that hair, 10% of that hair, that shadow is 10% less.
But hair will still grow back.
Right. So the good news is that letting your hair grow out to a number 1 or number 2 clipper or longer, if you're a woman with a ponytail, you're never going to miss that hair, ever.
Do you do a lot of transplants for women too?
We do. So
you do?
40% of my patients are women in the practice.
Interesting. I had no idea.
Yeah, it's a big part of the practice and has been for a long time. A lot of that has to do with the non-invasive therapies, the PRPs that we've done, the prevalence of plastic surgery these days and scar tissue that maybe obliterated a sideburn or an eyebrow. I also am one of the pioneers of eyelash transplants, so we do a lot of those in the practice.
Interesting. Oh my gosh, this is like a whole other world.
Yeah.
And
The world of hair.
Yes, the world of hair. I love it. I know where to go if I have an issue. Now I'm like, is he analyzing my hair? Is he?
Of course I am.
Is he looking and saying, it's a little dry on the ends, but?
No, I'm just teasing you. You have beautiful hair, so don't worry.
Thank you.
You just got to keep it that way.
Exactly. Take care of it. And for me, I know thyroid is a huge factor. So I'm just so amazed. So you can see patients from anywhere in the world, but you have, obviously, there are some things that you do that you need to actually see them face to face.
Correct. So we can certainly initiate consultations virtually.
Yeah.
And they can do that through the website. BaumanMedical.com is where they can click schedule a consultation. There'll be a request for photos as well as some questionnaires that you need to fill out, obviously. We'll connect via Zoom from anywhere in the world, from your home or phone.
Awesome.
And so we can start that conversation. We can start to build that medical history, determine those risk factors, take a look at the areas of concern, right? Sometimes we can make a very efficient diagnosis that way.
Yes.
But we're not going to be able to do a density measurement, at least not virtually yet.
Yeah.
We're working on it, a couple of different ideas. But for that, you're going to have to come into the office. Let's measure those densities. Let's see what's going on. And for most patients from a distance, they need to only come in maybe once or twice a year to make sure that their treatments are on point.
And then, just like if you're from out of town, it's not like you're having a major surgery where you have to have a lot of time for recovery and you can't travel back home.
Correct. So for many, many years, we've provided the hair restoration vacation, as we say. That was featured on CNN back in 2002. That's where patients come in, get their procedure, and recuperate in beautiful Boca Raton, Florida. Many of my patients stay at the gorgeous The Boca Raton, which is a hotel and club right down the block from my office. It's a gorgeous seaside location.
Nice.
They can stay on the beach at the beach club. They can stay on the harbor side at the tower or in the bungalows. And it's a very, very private and discreet way to recover from their procedure. So we do have a lot of CEOs and professionals that come in for those kinds of therapies, as well as the average Joe.
I like that.
Yeah.
I like that. Okay, so where would somebody start with you?
So the main place to start, if you've got a thinning hair concern, if you're noticing a change in your hair, if there's breakage, if there's a receding hairline, if you're noticing more scalp shining through, you've got to get the accurate information. Start at baumanmedical.com. Even if you just want to ask a question, you can go to baumanmedical.com/ask. And there's buttons there to initiate a consultation. So it just says start consultation. Again, there's some questions that you need to fill out. We want to get some background. And it's going to request that you send in some photos. So just be prepared to take a couple of selfies. You can cover your eyes if you don't want them to be identifiable. And then my team will reach out to you and coordinate a consultation. So there are fees for consultations.
Yeah.
It varies whether you are interested knowing that you need a surgery right away. There's a separate track for that. Or if you just need a traditional consultation. If you want to speak to my nurse practitioner, sometimes those appointments are available a little bit earlier. And but I would say baumanmedical.com is the place to start.
Okay.
And of course, patients and people find me all over the world on social media. So you can find me on all the regular social platforms at Dr. Alan Bauman.
Okay, that's perfect. Now I do have to ask you one more question.
Okay.
Here you're doing some cool stuff at the Biohacking Congress too. What are you doing over here?
Correct. So we love to come in person to Biohacking Congress because, first of all, we get a chance to meet all kinds of like-minded individuals who are also on the biohacking path like we are.
Yes.
Which is great, being able to interact with the tribe and to find out what's the latest and greatest stuff in the world of biohacking, but also to bring technology. And so what we brought this time is the AI-powered microscope called Hairmetrics. And so you can stop by the booth and get your hair measured. That's the AI-powered microscope that does a density measurement, hair caliber measurement within just a minute, like that. You
I gotta do that.
Yeah, so you should stop by.
Yeah.
We'll look at a couple different areas on the scalp. It tells us a lot. It takes a complete inventory. But we're also demoing the latest and greatest biohack for hair, which is called TED, T-E-D. Transepidermal delivery. Now this is a device and a procedure that we do in the office. Transepidermal delivery is a game changer in the world of hair restoration. We're using ultrasonic waves. Think of it like, have you ever heard of jewelry cleaner?
Yes,
or like
of
an ultrasonic toothbrush,
Yeah.
kind of has a buzzing
I
sound.
have that.
Okay, so that kind of technology applied to the skin with the correct wavelengths and vibration. First of all, it's painless, so that's good news, but it disrupts the moisture barrier of the skin temporarily. So the stratum corneum, that's the stuff that keeps the moisture out, and also any treatments that you might want to put on your skin keeps that stuff out too, unfortunately. Well, the TED breaks up the stratum corneum. We apply a powerful hair growth treatment using growth factors, peptides, amino acids. We use the TED device to drive that right into the scalp. And so we'll treat zone by zone. So you can test it here and feel it. It's a no needle,
So
no
cool.
pain, no recovery procedure. Patients in the office that will experience about 30 to 45 minutes of that treatment to treat the whole scalp.
And so is that something that's good for, if you just notice your hair's falling out a little bit more lately and you just want to...
So let's talk early intervention, right? So if
Okay.
you're in the early stages of hair loss, you don't really have a big receding hairline, you don't have a bald spot, you might be noticing some shedding, maybe from being sick or COVID or from the vaccine or
Right.
some other trauma that's happened. If you have a shedding phase, TED rectifies that. It immediately anchors the hairs more tightly into the scalp, and it provides those growth factors and peptides which turn the hair follicles on and keep them on.
That's amazing.
Yeah. And so that's a great technology in the early phases. So if you have thinning or breakage, you definitely want to start with TED, something like TED. And especially if you're a little needle phobic, because there's no blood draw, there's no local anesthetic. So that's why we brought it here to Miami, right here. So, that thing's been running all day long. People are testing it and trying it. And they can also actually execute an entire treatment while we're here at the booth. If
That's
they want. They have to
amazing.
make a reservation for that.
That is awesome. Oh my gosh, so much to learn. Thank you so much.
Oh, it's totally my pleasure, Sandy.
This has been a great conversation, and I hope that everyone checks out Bauman Medical.
Well, thanks so much for having me. Hopefully we'll be able to increase their hair span through the latest and greatest treatments and procedures.
Oh, I'm going to go to your booth now.
And change people's lives that way. Yeah, come on, let's go.
Okay, thank you so much.
Take care, everyone.
Bye.